Hi, it's nice to meet you of the pediatric nurse practitioner. Uh, Tell me what interested you in the position today.
Well, I've been working in the trauma center and the pediatric units, and I furthered my education to be a pediatric nurse practitioner, and I'm interested in working with children in this population.
Can you tell me about some of your strengths or attributes?
So my strengths is that I work really hard and I work well in a team-oriented environment, and I love working with children.
Um, what would make you a good candidate for this position?
I'm very passionate about this line of work, furthering my education so I can better serve this population group.
Is there a particular age group you like working with or population in particular within pediatrics that you like?
Um, I I like all the children. Those younger than 5 are a lot of fun to work with, but all in all children are enjoyable.
Oh. So how would other people describe you, whether it's a supervisor or coworkers?
I believe people would describe me as a hardworking individual who works well with others, who truly enjoys what she does for a living.
You ever faced a difficult situation in which you had to make a difficult decision or have to take a large risk?
I have, yes. Working in the trauma center, some individuals are not used to working with children, so there are times where you have to make decisions on waiting till the situation's over, but stepping in and saying that certain situations were unsafe for the patient.
So for all right, where do you see yourself in 3 years?
Hopefully, in this position, working with children, maybe even furthering my education to better serve this population group.
Sounds great. So, do you have any questions for me about the position itself?
Yes. So I was wondering what kind of training or learning opportunities I might have in this position.
So training opportunities would include spending time with some of the already established practitioners to familiarize yourself with our facility and our policies and procedures until you're comfortable with that. So that's the few, but also, there's plenty of opportunity to either access continuing education through us or be reimbursed for that. And, we definitely encourage people to further their education and get certifications and other things pertinent to their position. So um, that's the types of things that we offer.
That's good to hear. How about did this position come available?
So we were expanding the department, so it's a brand new position. So no one's left, and there hasn't been any turnover actually. But we wanted to add on another advanced practice nurse to. Um, yeah, it's a great opportunity.
It's good to hear.
Uh, any other questions?
No, ma'am, that's everything.
All right. Well, it's great. It's great to meet you, and we'll be in touch with you shortly.
Thank you. All right. You ready?
I'm ready.
Okay. Hi, my name's Rachel. I'll be interviewing you today. What made you want to apply for this job?
Well, it seems like it's a great position in the location is providing access to psychiatric patients to get care, which has been, there's many barriers in mental health to get the proper care. So it just seemed like a great position and location, and um, so I'm really interested in learning more about it.
Awesome. So tell me about your background as a RN before you became a nurse practitioner.
So I worked in a detox facility for detox dual diagnosis inpatient for about 5 years. At the same time, kind of overlapping, I worked at and still currently work at an inpatient psychiatric unit for adults. So we see anything from depression, anxiety, mood disorders to bipolar disorders, psychotic disorders, and substance use. So it's quite a variety of patients.
That sounds like you got a pretty good background then in this field. What are some of your strengths that you think you might have?
Some of my strengths include that I'm very enthusiastic about this field and my job. I really dedicate myself and want to improve the quality of care for patients. So, I think that and being a hard worker and just is kind of one of my strengths.
Good. Do you think you have any weaknesses that you might be able to identify?
I think we all have some sort of weakness, but in particular, I would say, I want the best for all of my patients, but sometimes you have to meet them where they are, and whether or not they're capable or able to put in the work, or just can't commit the time, or don't feel like they need to make a change at a certain point in time can be difficult. So that's something that I can struggle with sometimes because I can see the potential in the patient, but if they're not willing to do it, then, it makes it tough.
Understandable. Where do you think you might be in 3 years?
I'm hoping to be in whatever position I'm soon to be hired in. So hopefully it would be here. And I want to be established in a place and get comfortable with it and have a familiar patient caseload, and maybe look at going back to school or starting to teach an undergrad psych nursing lecture. That would be something interesting to do. So.
That sounds good. How do you think your friends or family or supervisors might describe you?
They would describe me as a hard worker, really dedicated, just really interested in learning more, always wanting to do the best for patients, and yeah, just being enthusiastic about the field.
Awesome. Good to hear. What type of work environment makes you feel most comfortable?
Just one that, there's other people around who are as committed to the patients and the environment as I am, bounce ideas off of or talk about difficult cases with, and just truly like what they're doing.
Good. Do you have any questions?
How did this position open up?
So it opened up because we had a provider that left. Her family had to move due to personal circumstances. So we are now looking for someone to fill her spot. We usually have a pretty good retention with our providers.
Okay, that sounds good. Um, Anything else I should know about the practice or facility, or anything that um, would be interesting for me to know about it?
Our doctors love working with our other providers and mid-levels to collaborate to find the best care to provide for the patients and safeties, to work on new policies together, and to find educational opportunities, just to make sure that everybody's up to par on what the safest and best practices for each of these patients.
That sounds great. All right, well, thank you. All
You're welcome. Well, we'll get back to you soon, okay?
right, thank you.